Are getting all the signs of your periods. You really think that you are actually about to see your periods, but days are passing and you are not seeing your periods. You are even getting cramps. What could be the cause of this? When a woman is about to see her periods and then she begins getting all the signs, we call them the premenstrual syndromes. Premenstrual syndromes. These signs include actually lower abdominal pain. They include that feeling of sickness. There could be a change in your moods. But you are asking yourself, why are you not getting your periods and yet you are getting the signs? In this video, I'm going to answer this question that has been asked by one of our friends just over here. And remember, this channel, it's called Omusau Gerald Massa. It's a fertility education channel, and I'm called Gerald Massa, a fertility educator. So when a woman is supposed to see her periods and then she begins getting the signs, and even the days she is supposed to see her periods pass without her seeing her periods, this could actually mean many things. There are two key hormones involved here. There's the first hormone known as estrogen, which is responsible for restoring the endometrial lining. It actually restores that inside of your womb in such a way that if it is balancing, your periods are going to actually be very regular. They are going to be balancing. But if the levels of this hormone are low, then there are high chances that you might actually experience changes in the days you were supposed to see your periods. What do you need to do if there are changes in your hormonal levels? You actually need to be patient. Do not rush the process. Be patient. Wait for at least 2 to 3 weeks. I believe your periods will come. They will actually stabilize. But if things don't work out, then you might consider going to your nearby hospital, nearby health center, whereby your OBGYN, your doctor, will be able to do some tests on you to find out why your periods are not actually balancing, why you are not seeing your periods. When a woman is not seeing her periods, we call this amenorrhea. Amenorrhea is simply the absence of your periods. It's brought about by many factors. Remember, the question is about our friend who is even getting cramps. She was supposed to see her periods, but she is not seeing her periods. I said that the first main cause would be that she actually is having what we call hormonal changes, hormonal imbalances. How can you confirm this? You actually should go to hospital and then your doctor will do some tests. The first test that is actually going to be done is what we call the fertility panel test, where they will do a whole assessment on your fertility hormones, including the follicle stimulating hormone, progesterone, estrogen, and of course the other hormone known as luteinizing hormone. But the most important hormones are estrogen and progesterone. So that would be the first reason why your periods are not being seen. The next reason why you could actually be missing your periods when you were supposed to see your periods could be that if at all you are stressed. Among the reasons why your periods may not appear, you could actually be stressed. Remember, when a woman is stressed, there's going to be changes in her hormonal levels. Specifically, there's going to be a hormone known as cortisol that is going to be released. But this can also bring about changes in actually when your periods will appear. If you are on some certain medications, these actually include drugs for allergy, asthma. These drugs could actually affect the frequency of your periods. The other reason would be that you could actually be pregnant, because when a woman misses her periods, it's among the first signs we can actually use to show that maybe you could be pregnant. But remember, the only way to confirm whether or not you are pregnant is you do what we call the urine HCG pregnancy test. If it is negative and still you are feeling the signs of pregnancy, you could actually do what we call the serum HCG pregnancy test.